So we're recording. I wanted to say we're recording the session for folks who might want to refer to it later or who weren't able to make it. So you should be aware of that as you're participating. It's a big group, so what we've tried to do with two co-presenters is kind of keep a close eye on the chat. So at any point, if you have questions, feel free to kind of type them in there, and then we'll make sure we come back to them. If we can make a bit of space for some actual verbal questions, that's fine too. But we'll rely on the chat for a lot of it. Suman from United Way is here with us, and in a moment, once everyone's kind of settled in, she will send a link to the PDF of the slides that we're using, so that you'll have that to refer to. And one thing you'll notice is there are some sort of bonus slides that I've put a light line through, just to let you know. We might not put them up on the screen, but we'll definitely be mentioning that content. So that way you'll have the information there on the slide if you want it, even though we're not necessarily putting it up on the screen. I think I'd like to start off by saying that as it happens today, I live in Guelph. I'm in Guelph. Most of you are in the Greater Toronto area, although maybe some of you live outside the city too and are working from home. But whether we're in Guelph or in Toronto, we're still on the traditional territory of many different nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat people. And I want to take a moment as we're starting today to acknowledge that, and to acknowledge that Toronto is covered by the Treaty 13 with the Mississaugas of the Credit. And I often sort of like to pause when I'm doing a land acknowledgement and think in particular about the Dish with One Spoon Treaty, because it inspires me that sort of spirit of sharing the land and reaching consensus despite differences, and then coming to some agreement about how to use the land together and how to invite new people once they come to the area to enter into that same agreement. And that's something I like to pause and think about as I'm starting any kind of gathering on this land. So by way of introduction, I should say that I work for an evaluation group called Taylor Newberry Consulting. And we are based in Guelph, Ontario, but we often work in Toronto and in York region and in Peel region, have for many years. We often work with nonprofits on evaluation projects, and we have quite a bit of experience on kind of the interaction between funders and nonprofits related to evidence and evaluation. We've had a number of contracts with funders like United Way. So we can bring that kind of insight into how that sort of dialogue goes and where things go wrong or how to be strategic about it. And I also want to say that in today's workshop, we've been contracted by United Way to do this, and certainly I think the timing is no accident. They're offering this training as they're launching their application for the new grant fund, but we are not, Vashish and I, speaking on behalf of United Way or able to answer any kind of direct questions about the process of through which those applications will be sort of reviewed and how decisions will be made and all that kind of thing. Thank you, Simon, for posting the slides there. I know Simon will also post an email address. You probably already know it if you've had a look at the application, which is designed for you to send any kind of real specific questions for United Way about their grant application. Vashish, do you want to introduce yourself?
Sure. Hi, everyone. I'm Vashish Tasrani, and I've been working with Andrew and some of my other colleagues at Taylor Newberry Consulting for 2.5 years now. I'm really passionate about working with nonprofits in different sectors and helping them with, capacity building, with coaching regarding evaluation, and also helping them demonstrate value to funders and other stakeholders, whether it's through reports or other deliverables. So yeah, I'm really excited to be sharing some of our experience and learnings with you today about grant making and all other things related to evidence and evaluation today. And looking forward to hearing about your experiences with evaluation as well.
I'm going to just share my screen. Which is always a little bit of a leap of faith for me, but I hope it worked. It seems like it worked. So our learning goals today, we want to understand how data collection and use of evidence is helpful when trying to do grant writing, and get into some of the jargon, the differences between activities, outputs, and outcomes, which a few of you asked about in your registration forms. Talking about how to address gaps and challenges in data collection, best practices in communicating results, and telling a compelling story when applying for funding. And I think that compelling story point is really crucial, because I mean, really at the end of the day, I feel like there's no point in doing evaluation or needs assessment or other kinds of research unless it's in the service of learning and telling a compelling story to someone who cares about it. And I think we always have to sort of walk that back. And I feel like lots of times organizations end up accumulating a whole bunch of data and a whole bunch of evidence, and not really feeling like it's translating into something that really helps them convey to other people what's important about the work and why those folks should support it, why they should be interested in it. And I think that's what we want to talk a lot about today, is how do you kind of get from a pile of data to a compelling story that really does justice to your work. And I think really the structure of that story is often a bit like this diagram in the slide. When you're doing grant writing, right? That you often want to start out and say, look, this is what's going on, right? This is the reality of the people that we are hoping to serve. These are the obstacles that they face. These are the assets that they have. This is what's going on in the community. And our idea is a response to that reality. We're not just dreaming this up because we like doing this stuff. We've decided on this plan of action as a meaningful response to what we understand about the community. So that's our idea about how to help, is built on what we understand. And then the difference that the project will make for people comes from that, right? Like, here's our idea, and this is why we think this idea can truly help in this particular set of circumstances. And then ultimately how that difference connects to what funders or donors care about. And I mean, you could say, oh, what's trendy for funders, changes year to year. And, we're always kind of repackaging the same work using different jargon to sort of fit into sort of this year's flavor of what matters. And there's definitely some truth to that. But on the other hand, I mean, at its best, I like to think of it as, if you can convince people outside of your organization as to why the work that you're doing relates to things that they see as important, then I think you're kind of connecting to the broader community in a way, right? Like the United Way's criteria are their effort to try to reflect what they understand to be important needs in the community. Same with the city, same with volunteers who might be willing to help your organization. So I think having a story that connects to issues that other people see as important, funders being just one example, I think is always important. So I think ultimately this is the narrative often that we're going for. And I think if I had to sort of start off by saying the one kind of big piece of advice I would give, I think it's that a lot of times people end up putting a lot more effort into describing their idea about how to help than they do in describing how that idea relates to the other three aspects of that story. And I think that's sort of human nature. And the example I often think about is, if you've ever seen the show Shark Tank, and when you think about the people pitching their business idea to these sharks in the hope of getting, them to invest in the business, when it doesn't go well, when they don't get money, a lot of the time it seems to me that they're making this mistake of focusing too much on their idea and not enough on telling a story that will matter to their audience, the sharks in this case. They'll have been working in their garage for years, and they've invested all their personal savings, and they've created this, gadget that they really love and they're really passionate about. And they talk about the gadget, but the sharks will often ask questions about, well, who else is in this space in the market? Where do you see it fitting on shelves? What's the cost point for it? Who's going to help you market it? It's really not so much about the gadget as it is about how the gadget relates to customers in the world. And I think the people who succeed in Shark Tank are able to kind of connect those dots. And I think it's the same sort of challenge we're talking about here. So to start with, I want to talk about kind of the first step in that narrative, which is, how do you ground what it is you want to say in the reality of the people in the communities that you serve? And ultimately, I think that a strong idea for action is something that responds directly to the experiences and needs and the voices of the people you intend to serve, that they are asking for or expressing a need for, or have somehow kind of let it be known that this is something that will help, this is something that will make a difference. And that being able to kind of demonstrate that somehow is the very first step. And that can, take a number of forms, of course, right? You can focus on, there's often research reports, from the city, from, public health, from United Way, there's that you can refer to that talk about trends or talk about gaps in service or talk about needs. Maybe there's research reports from other cities that talk about certain ways of intervening that have worked there and why they've worked. I think sometimes that stuff is great, but I think one of the unique strengths nonprofits have, I think, is that they are often much more grounded in the reality of day-to-day life in certain neighborhoods, or if it's not a geographic neighborhood, certain population groups, and they are really on the front lines and seeing on a day-to-day basis what's actually going on in people's lives. And I think that perspective is something that you're uniquely positioned to share. And frankly, I think United Way relies on you, in order to kind of convince its donors that it is, up to speed on what's really going on in the communities. They look to you to be able to kind of give them that credibility. And so I think that drawing on that kind of information as well as on research reports is great, whether that it takes the form of, an evaluation project you've done yourself, or a community consultation process you've done yourself, or stuff that's just more kind of from your day-to-day feedback, stories, voices, that kind of thing. I think it's also important to realize that connecting to your community has a lot to do with understanding history and context. To say a bit more on that on the next slide, that a good idea that worked in, Saskatoon, probably emerged out of what was going on in Saskatoon at that point in time, and what other systems were doing or not doing, and what the gaps were, and what was going on, and who the people were, and who was being marginalized in that particular community at that particular time. So that idea might not necessarily drop right into Toronto and work exactly the same way, because the history and the context is different. And perhaps you as an organization are in a different position relative to the people that you serve. Perhaps you have more credibility, perhaps you have less credibility, perhaps you have staff that are members of that community, perhaps you don't. And all of those things, I think, factor into telling, making a compelling case that you are well positioned, I guess, to respond to a particular need. And I think part of that is about understanding power and privilege and thinking about, all right, who came up with this idea? Was this idea something that emerged out of the voices of the people that we say we want to help, or did it come from academic experts, or did it come from, our own staff, or who got privilege in setting up the agenda for what we were going to try to do next here? I think another thing that's really important in this stage of kind of answering, it's often one of the first questions on a grant application, right, is kind of what's the need in the community that you're trying to respond to. I think one of the big things that people sometimes make a mistake with is they try to present themselves as kind of the the only group that knows anything about this issue, or the only group that can act on it, and sort of present their story as if they're in a vacuum, as if absolutely nothing's going on in the community and they are stepping in to do the only thing. And I mean, sometimes that's true, but often there are other groups that are at least partly addressing the issue that you want to help address. And I think it's strategic to sort of tell a story in which you say, hey, listen, we know there's good things going on in the community. We're connected to the people that are doing those good things in the community, and we've listened to them, we've understood them, and here's what we all agree is a gap. And that's why we're responding with the idea that we are. So by way of example, I think the distinction is often in how people answer this question about what's the need in the community that you're responding to, is I think you want to try to avoid answers that are inward looking. that are about your own organization. And you want to try to offer answers that are more community focused. So you want to say, so examples of inwardly focused answers are, we're applying for a grant because resources are scarce, because our rate lists are long, because we lost funding from another source, because we have trouble recruiting trained staff. Those are all answers that have to do with kind of keeping the doors of your own organization open. And I think much more compelling messages are outwardly focused, right? Focused on the community. Look, we're asking for this grant because we're trying to adapt to respond to changing needs or increasing needs. We're trying to listen to community members who have told us that this is needed. We've been doing this for a while and we've made a measurable difference and we really know it can help. There's a clear gap in supports in the community, which we can demonstrate through some evidence. Now, I want to say that all of the things on the left-hand side of this chart are true and important. And as nonprofit leaders, I understand that you have to worry about keeping the doors open and you have to worry about finding the resources, and that grant applications often want you to focus on programs and aren't willing to fund infrastructure, your bookkeeper, your repair for your van, those kinds of things. And that's a huge issue in the sector. And I know that there's been lots written about that, and I know funders are beginning to sort of try to find ways to acknowledge that truth and handle that truth. So in putting this chart up, I don't mean to suggest that the things on the left-hand side are not important or not things you're worried about. But I think, in my experience, they're often related to the things on the right-hand side. And if you can help people to see that connection, I think they're much more likely to want to support you. So if you just say, resources are scarce, for our program, it sounds like you're looking for money to keep your doors open. But if you can say, look, statistics show that the homeless population is a population that's been underserved for years. There aren't very many programs for them. Our own program is one illustration of how insufficient the resources are for addressing this need, and that's why we're coming to you. So I mean, you really are, you're saying resources are scarce, but you're explaining to people why they should care about the fact that resources are scarce. I know it's not easy. I know the process of trying to write something that does a good job of explaining what the need in the community is it can be hard to know when to stop. It can be hard to know when you've said enough. Sometimes one thing I find people ask me about is kind of the difference between a need and a solution. That sometimes you'll say, what's the need in the community? And you'll say, well, the community needs another after-school homework program. And I think, well, an after-school homework program is a solution, right? It's a plan for action. What is it that's going on in the community that you think will be improved through an after-school homework program? What lies behind that you're trying to respond to? And so I think trying to really get into the reality of what's going on in the community before jumping into that second part of the story, the this is my idea for what to do about it. As I mentioned earlier, another thing I think that often happens is people present a case for what's going on in the community that doesn't place the voices of the people in need at the center, right? So a simple example of this that I've seen many times is people will say, well, we talk to parents in the community, and parents in our neighborhood really think there needs to be a drop-in center for youth to get the youth off the street corners. And I often find myself thinking, okay, like, what do you think? And very often youth don't see the fact that they're hanging out on street corners as a problem that needs to be solved. They're perfectly happy to be hanging out on street corners. So that's a mistake that people often make, is not privileging the voices of the people that you intend to help in the process of making the case that there's a real need out there, a real gap, something that needs to be responded to. Oh yeah, I stopped sharing my screen. But I'll put it back up now, because to wrap up this sort of first little point, I wanted to I wanted to just sort of say one thing we're going to come back to throughout this morning's presentation is this sort of a little script. So we put up that arrow with the 4 boxes at the beginning. And so this is a bit of a fill in the blanks. Obviously, you might not say it exactly this way, but I think a good story as part of an application for funding often starts by saying, listen, we know that blank is a significant need or priority for this population. And we're not the only people who know that. Other stakeholders, including X, Y, and Z, also see this need too. I think we all agree this is a need. We know that there's great work going on to address this issue, but we also know that there are gaps in our collective response, including blank. And I think this works even if you're talking about an existing program and you're applying a grant for an existing program. The gap suggests you're suggesting something new, but I think we all know there's great work going on to address this issue, but we all know that there would be a significant gap in our collective response were it not for X, this program that we do. So we'll come back to this kind of story and add some more parts to it as we go along, but that's kind of the first part of it. So are there any questions about that before I'll keep an eye on the chat. Is anything I've said so far need clarification, or is there anyone who's tried to do this and come up against a tricky situation? Okay, well, I'll continue on, and we'll see what happens, and we can certainly come back to this content if need be. So the next piece I want to talk about is sort of the second box in the story, which is describing your idea and talking about what it is you intend to do and how that set of actions is going to help and what kind of difference it's going to make. And this really gets into that whole sort of distinction between what is an output, what is an outcome, and what is an activity. So we thought to kind of kick this section off, we do a little exercise. So I'm going to throw up a poll, and what this does is it offers 5 statements about a fictional program. And what I want you to do is respond and tell me which statements you think are activities, which ones you think are outputs, and which ones you think are outcomes. So the fictional program in this case is a community gardens program. So I'll just go ahead and leave that open for a few minutes, and you can go ahead and respond. Read those through. You have to scroll down because there's actually 5 statements. And okay, we got people starting to log in there now. I'm not sure, Margaret. Oh yeah, okay. This is just clarifying your question there in the. Great, thanks everybody. The numbers are going up. Vishish is going to make a few comments about response rates for surveys later, and we're currently at a 75% response rate, which if this was an evaluation project out in the real world, we would be thrilled about, wouldn't we, Vishish? Would be so excited to have 75% response rate.
Yeah, that's an amazing response rate. Usually we're lucky if we get 20% of the population.
So the responses are slowing down a bit. So I apologize if you haven't had a chance to respond, but I'm just going to throw this up. So now, so activities are statements about what actually goes on in your program, the things that you do, the steps that you're taking in order to try to sort of help folks. And so we are working with 4 communities to set up new community gardens is absolutely a description of what's going on in the program. It's an activity. So everybody got that right, which is really good. Now, outputs and outcomes are a little bit trickier to differentiate. Outputs are statements that speak to how much work you did, how many times you did something, but don't really say whether that made a difference in someone's life. A statement that talks about making a difference in someone's life is an outcome, or making a difference in a community's life, that's an outcome. And one of the reasons outputs and outcomes are tricky is that they depend to a great degree on context, right? So I think United Way might say, we gave out a bunch of grants to nonprofits this year, and we gave out this much money in grants, and you could argue, well, that's an outcome for them, right? But for the nonprofits that receive the grants, if they say, well, we got a grant from United Way, it's not really I mean, it's helpful, they're happy about it, but it doesn't really show that they've made a difference in the world, right? They've just received money from United Way. So, it's one of those things where whether it's an output or an outcome depends a little bit on what kind of program you're running and where you are. But in this particular case, I think we've all agreed largely that our community gardens have generated 400 kilograms of food for participants is an output, right? We don't know yet, are participants healthier? Has that addressed food insecurity for them? Has that built a stronger sense of connection to the community? We don't know. All we know is that we've generated some food. We've generated some vegetables. So everybody seems to be on the same page there, that that's an output. And again, I think we're all on the same page around participating gardeners report eating more fresh produce since joining the program. Okay, so here we're really talking about having made a difference, right? Having kind of changed someone's life, things are better off. It's modest, right? We're not necessarily saying that they're healthy yet. We're not saying anything too ambitious, but we're definitely saying they've made a difference. So we're all on the same page there. Now let's see, be interesting to see with 4 and 5, I tried to make them a little bit trickier because these are more about kind of system level activities and outcomes. So, we presented about this work to 2 different planning tables. Is that an activity or is that an output? I think I agree with most folks that it's an activity, that's just describing the work that you did. I suppose you could say the number of times we did it is an output, right? So our activity is we go out and we present to planning tables and we try to give them information about community gardens and why they're important. And then the number of times we made those presentations arguably is an output. So I think the folks that selected output are not wrong in this case, but again, it depends a little bit on how you're looking at it. And then and I think again, it seems like we've agreed that the city is now providing financial support to neighborhood gardens. So because we did those presentations and we went out and presented at those tables, we've now leveraged additional resources, and that's meaning that more community gardens are being set up. So when we said we're opening our own community gardens, that was an activity. But when we're saying we've been successful at persuading another entity to open community gardens, that's an outcome. Right? Like we've really made a change in the community at a systems level or at a community level. We've really made a difference. So great understanding of the difference between activities, outputs, and outcomes here. So I want to, I'll pause that. I want to talk for a moment about the importance of short-term outcomes. Because I think one of the things that can sometimes be really tempting is to try to come up with really impressive sounding outcomes. that show that you've changed the world, right? So you want to say something like, well, we run resume workshops and we offer job search support. What's our outcome? We wanted to say something impressive, right? So we say, well, we're going to reduce unemployment, and I think that's a big logical leap, right? Like a resume workshop is going to reduce unemployment. It seems like there's a lot going on there that hasn't been said, and I think it's absolutely true. I mean, I 100% agree that the resume workshops and job search support are important elements of a plan to try to reduce unemployment. But the great thing about short-term outcomes is that they sort of unpack the logic there a little bit, right? So the resume workshops will lead to clients being more likely to get interviews, maybe clients who are newcomers understanding the process of applying for work in Canada. If that happens, they're more likely to get hired, which will help to reduce unemployment. Or similarly, we do job search support, and that means that people network a little bit. It means that they're perhaps less discouraged. They have, someone to talk to on a day where things are hard, and that also helps to get people hired, and that ultimately reduces unemployment. And I think the short-term outcomes are so important because it's not like you're letting go of your impressive statement that you're trying to reduce unemployment, but what you're doing is you're kind of managing expectations for exactly how your particular program is contributing to that work, right? And obviously the boxes that are in blue are a lot easier to measure than the boxes that are in green. And I can't tell you how many times in my career people have said to me, Andrew, it's hard for us to do evaluation because our outcomes are really difficult outcomes to measure. Sometimes that's true, but 9 times out of 10 when people say that, it's because the outcomes that they're trying to measure are long-term outcomes that they don't have control over, where there's a whole lot of intervening factors, like if a factory closes in town, unemployment's going to go up. And whether we're doing a good job of our resume workshop program or not, unemployment's going to go up. So short-term outcomes, I think, are a really powerful way to link your work to big important outcomes that everybody cares about, but also to zoom in on the things that you can control, the things that you can measure, and also the things that differentiate your particular program from other programs also working on the same big picture goal. So just to give you a quick example, we could say, well, our outcome in our program is that we help kids grow up healthy. And you think, my goodness, that's hard to measure. What does that even mean, grow up healthy? Where do we even start? It's kind of overwhelming, right? But it's not really a measurement problem. Like if we drill down a little bit and say, well, our after school program helps kids manage stress better. Okay, all right, so it's a little bit more focused now, and it starts to get a bit easier to think about where we might find the data to get an answer to whether or not we've been successful doing that. And if we get really, really concrete, we're kids who are dealing with trauma come to our program and they learn and practice practical skills for managing emotions. And I think we can all agree that's one important step on the way towards improving mental health. And it's a lot easier to measure, right? I mean, once we get that concrete and that practical, it's a lot easier to figure out what might be some good ideas for how to identify what kind of data would be persuasive. I know that was a comment a few folks raised in the registration form is, I bet there's lots of kinds of data I could get. What's the smartest kind of data for me to get that would really make the case? And I think often the smartest kind of data is the data that gets right to the immediate, practical, short-term ways in which you are helping. And a lot of times those things are so, when you run a program, they almost strike you as boring. Like they're so obvious to you, they're so everyday to you that they're boring, and you want to come up with something fancier and more impressive to say about the work that you do. But at the end of the day, that's where you're going to get the strongest data, is on the most immediate ways you're helping people. And the other thing I want to say that I think is really important is that saying that an outcome is short term, I think sometimes leads nonprofits to believe that that they should focus in on individual change, right? Like a one person learning a new skill, or achieving new knowledge, or maybe making a new friend, and that it tends to sort of individualize the work and kind of devalue our efforts at systems change or our efforts at community change, right? Because those things are harder to kind of drill down into practical short-term, like, if you're doing advocacy work or policy change work, it's not as easy to get concrete about the outcomes as it is if you're sort of saying, well, we had these 10 kids and they came every Thursday for 8 weeks and we taught them a new skill. But I think that's not necessarily true. I think you can get concrete and short term about the outcomes of neighborhood work and the outcomes of systems work, right? So, let's say we're doing neighborhood development work, and Vashishta has done some of this kind of evaluation. There's neighborhood work in a certain community, and we don't know necessarily what the community is going to end up sort of deciding as far as frontline programming goes. But in the early stages, one of our outcomes is just that more neighborhood members are coming out to events. They weren't before, there weren't conversations going on in the community, but now there are more people coming out. There are different people coming out. There are people from different backgrounds who live in the neighborhood coming out, that kind of thing. So that's a short-term community level outcome. At the same idea, at a systems level, there can be short-term outcomes like access to obstacles to access have been removed. So this is an interesting example of this. Is there's we've been thinking a lot lately, and I know United Way has too, about the importance of social identity data, and gathering data about who the people that you serve are. And if you're able to come up with data that said, listen, a year ago, here's the demographic makeup of the people that were coming out to our program, and now, given all the efforts that we've taken towards outreach, here's some sort of concrete social identity data that really shows that we are reaching a broader and more representative cross-section of the people in our community than we were a year ago. Now, I don't think you could claim that that's an individual level outcome. Like, I don't know those people, whether you've helped them in any tangible way in their own lives. But I think at a system level, you could argue that's an outcome, right? Like, we've made a difference in the community because we have removed obstacles to access. And now here's evidence that shows that different people are able to use our service that weren't able to use it before. So I just wanted to say, when we're talking about short-term outcomes, I don't want you to get the impression that that means we can't talk about systems change, I think, or equity. And I think we absolutely can. A couple of areas where it's tricky to, and I'm interested, maybe folks have faced these challenges, because I've certainly seen them many times, is that, it can be hard to kind of get that, to really name that outcome clearly in situations where, the outcome really doesn't happen until a long time after your program ends. People will say, well, really, like, we're working with kids in a middle school, but ultimately, we're hoping that they're going to be more successful in graduating from high school, but that's not going to happen until 5 years after they leave us. And I think that's often true, but I think that's a classic example of the long-term, short-term problem, right? Like, okay, if you're doing good work that will ultimately improve the chances that kids will graduate from high school, there are going to be some short-term outcomes that you're going to be able to see right away to suggest that you're on the right track, right? Like, they have improved attitudes towards school. They are, I don't know, missing fewer classes, whatever it might be. Another one that comes up a lot is the prevention one, right? Like, well, like, if we do our job well, then bad things don't happen, and so how do you measure, or how do you articulate an outcome when what you're trying to do is not have something happen, right? Like, not not becoming homeless, or not engaging in criminal behavior, or not using substances, whatever. And I think the trick there is to sort of try to turn the absence of something negative into the presence of something positive, right? So what is it that you're trying to add to that person's life that is going to sort of be a protective factor against those bad things happen, right? So if you want to, I don't know, if you're trying to prevent heart attacks, maybe you talk about, well, I'm getting the person out walking more often, right? Rather than saying what didn't happen, you say what did happen. So that, I'm going to pause my screen sharing again so I can see the chat. And I just wonder if there's any, oh, there's a whole chat that's been going on. You guys have been chatting with Vishish while I've been talking. I didn't even know. So are there, and he's been answering your questions. Are there any other questions about this topic before we shift? Okay, one thing I wanted to say was that people sometimes ask about, what are the best kinds of data together? What are the most persuasive kinds of data? Like, is it better to have statistics or quantitative information, numbers, or is it better to have stories? And if we feel like stories capture what we do better, but funders are more interested in numbers, how do we solve that problem? And I think this whole piece that we've been chatting about here really is the secret to that. I think the key is to be super concrete and clear about what the change is that you're trying to make and why that change is important and how that's a step on the road towards making something big happen that we all care about. And I think the clearer you get on that, the easier it becomes to make good use of the data that you're able to gather, whatever kind of data it is, right? So another example I didn't mention on the last slide was the idea that sometimes outcomes are very individualized, right? So you could say, well, I mean, I don't know how to tell you what the outcomes are. Like, the outcomes are different depending on who comes through the door tomorrow, right? Like, we'll try to do our best to help people in whatever way they need to be helped, and in order to kind of get them to where they need to go. So it's hard for us to name outcomes, and that's why we want to be very flexible. And I think often in those kinds of situations, what we do is we say, well, let's take a bit more of a story-based approach to evaluation. Let's really sort of try to pull out the complexity of how change happens for people, and not act as if it's like a little simplistic machine. Whereas if we give people one new piece of knowledge, then they can kind of go on and their life will be better. It's messy, it's dirty, it's complicated. I mean, that's obviously a marker that the right kind of data to gather is going to be more qualitative, is going to be more in-depth, more exploratory. But you're not just offering that because it's easy. You're doing it because it's the right way to get an answer to the question that you're asking. It's a right way to demonstrate the kind of impact that you're having. So the methods are in the service of the story and in the service of the case that you're making about why your program is worth doing. And a classic example of that is kind of an approach that we sometimes use where, when at intake, we'll have people say, well, like, what are your goals in participating in this program? And it's okay for people to say whatever they want are their goals. And then at the end of the program, we'll remind them what they said and say, well, listen, you said these were the things you wanted to get out of the program. How much progress do you think you've made on those things? And that way we're able to roll that data up and say, 80% of the people in that program made progress on their own personal goals related to employment or whatever. And then it's okay for each of those goals to be different, So there's ways to come up with methods that handle those kinds of problems, but the key is to be really clear about why our program works the way it does.
Can I add something to that, Andrew?
Yeah.
Yeah, I think another thing I wanted to mention along the same lines, where a lot of you might have community programs where outcomes might be unique for everyone that comes in through the door. But using that story-based qualitative data approach that Andrew is mentioning, you do that data collection and analysis for a couple of rounds. It might give you an idea of, like, everybody's unique, but here are the main themes. Like, usually people come because they need help with employment, or they need help with getting their youth to be more active, or their children to be more active. So then you can when you're talking to a funder, whether it's through a report or another deliverable, you can say that historically people come in for X, Y, Z reasons, although everyone's needs are unique. So you're able to describe your program in a more tangible way, even if it is extremely unique to each person that walks in, and you do offer a lot of services. But this data collection sort of acts as like a pilot to be able to give examples of what type of impact you're able to have in people's lives.
Thanks, Vishesh. That's a great point. I want to come back to this script that we talked about earlier, and we've got up here on the screen the same first part that we had up before, but now we've added sort of a second part. So, okay, we know that this is a significant need. You know it's a significant need. We all agree. We know there's good work going on, but we also know that there are gaps and there are needs and there are things that aren't being done. That's why we're taking action with Program X. We think this plan can really make a difference because we have some evidence to suggest that it can help. Maybe it's our own evaluation evidence, maybe it's data from another similar program somewhere else, but maybe it's people in the community saying that they want it. But we've got some evidence. We didn't just dream this idea up with sort of vague good intentions. We really think this is a smart place to put resources. In particular, we expect this program to make a concrete change for our participants with respect to these specific short-term outcomes. You know, carving out a niche. This is the contribution that we're going to make. This is something we're going to add to the mix that we think is really sort of worthwhile. And let me tell you exactly what we intend to do in concrete terms with components and activities. And I think the key thing, and we'll keep coming back to this, is that these things are aligned with one another in a strong narrative. You know, so the program idea very clearly references the community need and makes sense as a response to the community need. And we'll continue to emphasize that as we go along through the rest of this story, that what's important is the pieces really link together, and they link together in a clear and consistent way. Right. This is actually a little bit ahead of schedule. I mean, is there a piece of what you wanted to say after the break that we can kind of start with and then come back after a break?
Sure.
Or?
Sure, I think I can get started with the next section. Yeah, we can go through designing good data collection tools, and we can stop and take a break before the next section, which is about making the most of the data you've got.
Great.
All right, so are there any questions? I think there's, yeah, someone asking a question in the chat. Find it challenging when asked how our programs will permanently change the landscape. This is hard to respond to. Okay, so Maureen is asking this question, and she's asking for us to pop back to the previous slide. To the elevator pitch, I think.
Yeah. I can jump in here, Rajesh,
Sure.
if you want. Maureen, you know, like I think very few nonprofit programs permanently change the landscape. I think it's an unfair standard to set, really. Like I think, and I don't believe United Way someone has ever asked. Maybe I shouldn't say that. It's a big organization. Maybe it has, but to permanently change the landscape. But I think the case is, look, if we agree that permanently changing the landscape is going to require change in areas A, B, C, and D, let me show you how our program is contributing to permanently changing the landscape, right? You know, like if we, like I think, you know, we chatted earlier about social identity data and being able to show that programs in the community are demonstrably reaching people that they were not reaching before. I think that's a compelling, you make a compelling argument that that is a necessary step towards permanently changing the landscape. All right, back to you, Vishesh.
Sounds good. Okay, so can we jump to the slide about managing data collection? Thanks. Okay, so I think we've started talking about some good practices to keep in mind when managing data collection already, but I'll walk through these and we can take some questions, and if people have experiences with data collection that they'd like to share, we can go through that as well before we take a break. So pilot testing is something that I mentioned a couple of slides back. I think that's really important for a variety of reasons. If you can pilot test your data collection tools with a small sample of participants before wider use, that's highly recommended. You'll be able to better understand, the user experience, if the tool is user-friendly, if the questions are appropriate, if it's a survey or an interview, if it's too long, if it's too short. So it gives you a great opportunity to test out the data collection tools and optimize them to collect the information that will be most useful for you, your partners, and your funders. Ethics and confidentiality, I think, is extremely important. So making sure you have an informed consent process for your participants, making sure you clearly communicate to them how data will be stored and used, who will be able to access it, and if you do use direct quotes, that you won't be identifying them, and if you are identifying them, getting explicit permission for that as well. And yeah, so I think when you are planning data collection, having a data collection team with clear roles is key as well. So who will be gathering the data, whether it's interviews or surveys, and who will sort of oversee the data collection at a broader level as well, because especially if you're running programs that are being offered across multiple modalities like online and in person, or data collection is being done in multiple sites, you do need someone that's more of a coordinator, that's managing the data collection, making sure the data is all compiled in one place, it's organized correctly. So that's key as well. And I think someone's raising their hand, so I'll just finish this point and then I'll take the question. So when you have a data collection team, I think having their buy-in will be very important too. So having them involved in discussions around why the data is being collected and having them weigh in on the tool collection will definitely make them more engaged. Okay, so somebody is raising their hand.
Margaret, I think.
Yeah, Margaret, did you want to ask a question?
Yes. Can you hear me?
Yeah, can hear you.
Okay, I'm a community volunteer in my area of the city, and involved in employment, overseer, like a liaison between a building site and my community. And one of the things that was brought up is data collection in terms of the areas where the people are coming from. And this was done through the employment agencies, but it was set up as a choice. They could or could not, they could or refuse to fill it out. And it was they didn't have to put their name to it. Like, their gender and why they want this job and so on and so forth. And let's say, give or take 100 individuals, maybe about 30 of them filled it out. So it's kind of hard to, even though you're upfront and fair and open and explain things, in the end, it rests on the individuals, whether or not they want this to give this information. And although their name would not be there, it still did not give them any comfort in wanting to fill it out. So in the end, we only have the data of those that was okay in filling it out.
Yeah.
So.
Yeah, I think that's a great point. And I have a couple of slides that touch on that, but I'll cover some of that right now. So I think one of the steps that you and your team took is what I would recommend: explaining to the participants why this data collection is being done and why it is important. And it may not always work, but just highlighting that, you know, the data that you give us will help us serve you better in X, Y, Z ways, whether it's you know, connecting you to the right organizations that are looking for employees when you're looking for employment, or connecting you to the right immigration services if you're a newcomer. So just outlining how the data will actually help the participants and others like them. So that's definitely key. And I think the other thing that may not be possible in every context, but wherever you can, is incentivizing the data collection. So, you know, we'll give you a gift certificate or cash, or you'll be entered into a lucky draw. So yeah, that's definitely a challenging situation that you described. And these are a couple of ways, I think, in which you could improve the response rate. Another way could be that, you know, maybe surveys are not engaging your clients or service users. So there might be other ways of getting feedback from them, such as embedding the data collection into your programming. So if they're coming in, if it's in person, or even if it's virtual, you maybe do a focus group with them, a brief focus group at the end of the session. Or if it's in person, especially, this has worked for a lot of our clients, they just informally ask a few questions to each client that comes in about their experience. And that's usually a good way of collecting some feedback as well. So yeah, I think it's a challenging situation, but these would be some of the tips we would have for trying to improve the response rates. Okay, so I see that Andrew is answering some questions in the chat. Did we want to jump back to managing data collection, and we'll wrap that up and then go on a break?
Sounds good to me.
Okay. Yeah, so I think I was talking about having clear roles for data collection teams and getting people's buy-in by having whoever's collecting the data should be, you know, weighing in on the data collection tools, the survey items, for example, and they should have, you know, very solid knowledge of why the data is being collected as well. Other than that, having a good data storage plan obviously is key as well. It kind of ties into the point around ethics and confidentiality. So, you know, where the data is being stored, who has access to that, having a solid plan for that. And just planning for things to go wrong, because things might go wrong, there might be challenges. So having some best practices in place, like a tip sheet for the data collection team. How will we troubleshoot if something goes wrong? So example that I can share with you is one of our clients, they are an arts organization who collected a pre-programmed survey about intended use. So they had an online program that community partners across the country were signing up to use with youth or with older adults. So they collected that intended use data, but then they didn't really get any responses for the post-program survey. So I think they launched it too late. So there were issues with getting enough responses. So there might be situations like that. And then for troubleshooting, what they did was basically use the contacts that they had in these community partners and get that feedback instead on a one-on-one basis through emails. So having some sort of plan to troubleshoot when data collection goes awry is extremely important. Okay, so I think I'll cover what Bev just mentioned in the chat, and then if there are any other questions, we can take that as well, and then we can go on break. So yeah, Bev is mentioning that providing gift cards before participants fill out a survey results in a better response rate than giving the card only if they fill out the survey, and assuming you have the budget to afford that many gift cards. Yeah, I think so. I think if it's something that like feasible within your budget and you can do that, then definitely let everyone know that you can get a gift card. Well, actually, now that I'm thinking about it, this is the way to do it. That if you are given a survey, you can tell the participants that they're free to answer as many questions as possible, or if they feel uncomfortable, they can actually stop filling out the survey, but they will get the gift card anyway. So I think that should be standard practice. So it shouldn't be contingent on them filling out X number of questions or completing the entire survey. So even if they attempt the survey, they should get the gift card. I think that's a great way of respecting their time and getting their buy-in, and will definitely lead to higher response rates. All right, are there any other questions before we go on break? Awesome, then I think we'll take a 5-minute break, and we can start getting into making the most of the data you've got, telling a compelling story with the data that you already have collected after we come back. So it's 11:04 right now. Let's come back at 11:09. All right, see you soon.
Hey, everybody. Welcome back. I was just thinking on the break, I was going to make one more point about this managing data collection slide, which is part of the reason why we put this up. Is I think these are, in many ways, these are the things that if you get in the habit of doing them, they're the way to avoid finding yourself in a situation where you don't have great data when you're trying to write a grant application. You know, because I think so often people will, you know, they'll set up a survey and they'll launch it, and then they won't look at the data until, you know, the end of the year when it's time to do the grant application again. And that's when they discover, you know, that they don't have very much demographic information, or that not many people handed the surveys in, or whatever the problem is. Whereas if you know, if you're consulting and if you're pilot testing, and if you've got someone kind of keeping an eye on the data collection process and sort of, you know, troubleshooting as you go, then you're much more likely to end up at the end of the year with, you know, with information that's useful. So that's part of the part of why we were throwing that slide up.
So we'll get started in 30 seconds, just allowing people a little bit more time.
Well, if it's okay, but just while we're waiting, there's a question in the chat that I might answer from Heather, and a related one from Laurel. When questions are skipped or prefer not to answer is chosen, how do we address this in reporting? What's the best language to use in addressing gaps in data collection due to levels of discomfort? Actually, you know what? I think you're going to get into that like in a couple of minutes, Vashish, right? Like, I think that if we can kind of hold that question for what's coming up. Laurel's tip here is a good one about managing data collection, to try to sort of keep things in one place so it isn't all over, so at least you know what you've got. And I think that's a great idea. And whether that's a, you know, like a complicated database, or, you know, a proprietary one that you buy, or whatever, some organizations do that. But, you know, sometimes we just use you know, kind of SurveyMonkey or Google Forms for that. And then, you know, that way it's easy to just kind of go in and see how many responses there are, you know, and it's kind of like a little mini database. So sometimes even if a survey is on paper, you know, we'll ask one of the staff, hey, as they come in, could you just kind of type them into SurveyMonkey, and then we'll just always have a live summary of all the data. So yeah, that idea of kind of the database is a good one. All right, I'll shut up and pass it back to you, Vashish.
Sounds good. So yeah, before we go on to talking about making the most of the data you've got, I just wanted to summarize the previous section. Like if you can go back to the slide around managing data collection, Andrew. So you know, the whole point of, go ahead.
I might have made this point while I was chatting while you were still away from your desk. So I think I made the point you're going to make.
Okay.
Sorry about that.
Yeah, no worries. So we can jump ahead then to next section. All right. So we're going to talk about making the most of the data you've got, trying to tell a compelling story to funders and other stakeholders with the data you have. And the whole point here is that you don't need to have perfect data. You just need to use it well. So we'll move on to the next slide. So this worksheet is a good way of organizing your thinking. Like whenever you're, you know, sitting down with your team and thinking about, you know, we need to start collecting data for a funder. So I think the first thing you should be taking stock of is, what data do you already have that answers a specific question? So here, as an example, they've given a question around reducing the frequency with which kids show up hungry to class. So that might be one of the outcomes that this program is trying to achieve. So for each of these questions that you try to answer through your evaluation, first, think about what information you may already be collecting that might answer part of the question at least. So in different areas. So quantitative information, this might include survey ratings, attendance numbers, information from intake forms, and if you have like an online presence, things like website hits and so on. And then also looking at the qualitative information that you already might be collecting formally and informally. So stories that staff might be hearing, written testimonials, things like photos, artwork created by participants, videos or media coverage of your program, anecdotes you might have. So this is all useful information that might help answer some of your questions. And during COVID, a lot of programs have switched their programming to a virtual programming or hybrid model. So you might have documents that sort of track how the program was modified to respond to different public health restrictions. And this might be useful data for funders as well to help understand how you sort of changed your program and how it's implemented and how that affected the program users and the outcomes you're trying to achieve. So once you take stock of all this quantitative and qualitative information you have, and you tie that to the evaluation questions you're trying to answer, only then should you proceed to the next step, which is talking about or discussing, what is the new information that we still need to develop a strong answer to this question? Are there new indicators or additional information that we need to collect, and how to do that? So before you start planning that, first just take stock of the information you have and how it answers the questions you're trying to answer, whether it's for a funder or for other purposes. Okay, so we can move on to the next slide. Yeah, I think this is a good way of saying that it's not always about how much data you have, but how well you use it. So using it thoughtfully to tell a compelling story of your program. All right, yeah, we can move on to the next one. So yeah, I think these are some of the questions you should be asking when you're looking at your data. Sometimes you can make very compelling messages with data that's not great. And that actually teaches you or gives you learnings that improve your program. So sometimes you might have incomplete data, but then that makes you realize, I'll give you an example to make it a little bit more concrete. So one of the arts organizations we work with, they had data that they were collecting from various sources like online portals, as well as manually collecting data about program use from some sites. And that incomplete data, where sometimes they didn't have the demographics for certain users, sometimes they didn't have like a follow-up, and I think I mentioned this before, they had the intended use but not the actual use. So all these limitations and all these issues with the data actually informed enhancements in the program design, that they decided to streamline the data collection on one portal. They decided to ask questions in a standardized way across tools. So they were able to tell a story of program improvement using that limited data to their funder, and how that led to a better experience for their users in the next round of programming. And another point here is that sometimes, let's say you administer a survey or some tool and you get a very low response rate, and people have been mentioning this in the chat as well. So sometimes that actually is a learning process, because you learn about the people that you're serving, that these surveys are too long for them, or they will respond better to interviews. So just being able to demonstrate that even with this limited data, like this is what you're learning, and these learnings, how they will improve your program and the experience for the end user. I think that is key, not having perfect data.
Ashish, can I offer another example of that? And it relates to kind of the question in the chat from Laurel too. We were doing an evaluation of an anti-poverty initiative, and one of the outcomes was that a certain percentage of participants would be off social assistance and, and have their own income at the end of the program. And the data was really messy. And sometimes there were people that were off social assistance for a little while, but then they had a setback. And so they went back on again. And then sometimes they were kind of on a different form of social assistance, and some went back to school. So they actually stopped working. And it was really hard to tell a simple story about whether or not, in fact, the program had helped people get off social assistance. But to the point you were making, we kind of used that to our advantage to say, listen, we looked, as Laurel said, to some other studies and said, this is very, very common in the pathway out of poverty. Very rarely is it linear. Very often there are setbacks. And so we kind of tried to turn what was difficult data into an asset by saying, this data really helped us to better understand just how nonlinear and challenging the pathway out of poverty is. And, and as you said, we kind of use that to make a case for why we were going in the direction we were going in for the next phase, kind of thing. Another good tip there from the Smith family. I don't know if the whole family got together on this tip or just one member of the Smith family, but thanks to you all. You can also sort of analyze specific questions. Yeah, like to the point on Vish's slide, right? Are there partial answers? I can say, listen, we got a lot more answers from boys than we did from girls in this program. So I'm going to share some data with you, but please understand this is about the experience of the boys. So it's useful in that regard. Please don't assume that it represents the experience of the girls, for example, or something like that. Like, make use of limited data in terms of certain groups filled in the survey, certain groups didn't, or certain questions were answered more than others.
Yeah, so I think there's a couple more questions in the chat. There's one from Deborah about the impact of COVID. So Deborah's asking, given the unique impact of COVID-19 on service delivery, any suggestions on how to frame the incomplete or misleading, quote unquote, data conclusions? Yeah, I think that's a great question. And a lot of the clients that we have been working with have been dealing with that, where before the pandemic, so I'll give an example of an organization from Mississauga that works on, their initiative works on improving food access and knowledge about food skills. And they're also a food bank. So they were running this program, sort of like a cooking program in person in their kitchen. But when COVID happened, they couldn't offer that anymore. They were also very busy with providing essential services through their food bank. So when it came time to report, a lot of those outcomes that they were trying to achieve through the kitchen program, they on paper didn't really achieve. But I think that's where the narrative piece comes in handy, that you talk about the impact COVID had on your programming, you talk about the changes you had to make, and you still highlight the successes that you were able to have, even if they don't exactly fit in those boxes that you had organized your outcomes according to. Because in this case, for that food bank, they were not able to impart food skills programming as much, but the success story was that even during COVID, they were able to help with the food security and food access needs of the community by giving food through their food bank, but also supplying food baskets to partners throughout the community in Mississauga. So I think in some of those cases, it's wise to sort of rise above some specific outcomes and talk about broader outcomes in the sector, that even if we weren't able to achieve some of the specific outcomes due to the COVID-related challenges, we were still working within that sector, in this case, the food sector. We're still making the food sector a stronger place, working with our partners, helping community members with their needs. So I think that's one way of showing that you're still relevant, you've been doing great work, you've just had some challenges due to COVID and had to sort of prioritize certain areas. And I think just talking about a plan that, as public health restrictions lift, this is our plan to sort of go back to the programming that we had originally outlined in our proposal. So that would be my advice in a nutshell. All right, so I think we can jump to the next slide. Yeah, I think we've started talking about some of this already. There are different things you should be thinking about as you're trying to make the best use of the data you have. Particularly, there are challenges with the data. So sometimes combining it with other data sources really helps give a better picture of program use or impact. So for example, I think the data, I keep talking about this one example, but if you have pre-program survey data, but you don't really have the post-program responses, in some cases, clients that we've worked with, they were able to get some of that feedback through emails from partners that they're, they have a good relationship with, who are really engaged. So they're able to triangulate those different data sources and come up with a somewhat accurate picture of what post-program use of their program look like. So some other strategies could be engaging more people. So this could be a second round of data collection where you say that, here are the gaps in the questions in the first round of data collection, either questions that weren't answered or questions that we think weren't clear enough to get the information we need. So doing a second round of data collection with either you change the tools, instead of survey, you do like a more targeted focus group, or you ask the questions in a clearer way. So this actually touches with one of the questions that was in the chat around skipped questions. So yeah, I think if you're writing a funder report saying that, people skipped questions because they weren't comfortable, and we'll look into either asking the questions in a different way, whether it's through a focus group or sort of drafting the questions with different language that is more comfortable and doesn't alienate people. So just remembering these strategies, even if you are dealing with the challenge of skipped questions or incomplete data. And there's another point that someone made in the chat that I'd also like to highlight. When you do have less than perfect data, I think linking it to the broader context of the sector, so reports in your sector or research is a good option. That our data tell us only part of the picture, but given the knowledge that we have coming in from these reports or these other organizations in the sector, we can draw inferences about the impact of the program and what it should look like in the future. So these are some strategies that you can definitely use to tell a compelling story and show the value that your program and your organization brings, even if you have data that has limitations.
There's a question in the chat about from Tuat about drawing conclusive information when you're not an expert, or drawing analogies or inferences, and are you going to be seen as kind of biased, when you're not an external third party?
Yeah, I think that's a good question. So I would say that if you can tie your findings to, as I was saying, the research and reports that are in your sector, and you can show similarities, that for one shows a funder or an external organization that whatever you're doing is in line with what's being discussed or what's being found in the sector by other organizations. And I think just being very clear and transparent with how you collected the data, how you analyzed it, that also shows like that you took an objective lens, and despite the fact that you didn't bring an external consultant, this is something that can be replicated. Like the data collection and the design that you have is very transparent, and here's how you've sort of accounted for biases. Just explaining that would be a good way to go about it. Okay. So yeah, coming back to the elevator speech, we're building on this as we're going along. I have two versions here for you. So this one here is for existing programs. The focus here is on talking about outcomes that have been achieved and pointing to the evidence that suggests that. So this is what we've achieved, and we know this because 90% of our participants say that they have experienced positive outcomes in terms of their mental health or in terms of their social connections, et cetera, et cetera. And also talking about learnings is key in this part of the elevator speech. So talking about the successes and challenges, but also going into the why. So why things worked or why things didn't work. And then of course, talking about program improvements. So how you're learning from all of this and enhancing your program. So the next one, if we can switch the slide. This one is a little bit different. Here you're proposing a totally new program. So you're trying to let people know that you have a plan for gathering data as you go. You're sort of saying, we know we have a lot to learn, but we have a plan to make sure we do learn, and just describing that in a little bit more detail. And you're showing that you have like your ear to the ground, and you know that there might be certain challenges, you're foreseeing them and discussing that as well. Go ahead, Andrew.
It's just, yeah, there's an important question from Sari that I wanted to speak to, which is easing the burden on nonprofits around data collection. And I think this is really important, and it's 100% true. And I know United Way would acknowledge as well that it's one of those things that everyone encourages nonprofits to do, but not many funders are really willing to kind of earmark resources, especially for data collection and analysis. And that's a big problem. And I think you're absolutely right. And I think that's something we should be working on at a systemic level. And I put a link into the chat there. We did a project a couple of years with the Ontario Nonprofit Network that led to a resource called Talking with Funders About Evaluation, in which we actually offer some concrete strategies for how to engage in a dialogue about this issue with funders in a proactive way, and kind of ask some questions and clarify some things. And for example, I think one of the things that's fair to say is, listen, if you aren't putting resources into evaluation, that's fine. But then, can you also kind of scale back your expectations as far as how much we're going to be able to share with you? Can those two things be in alignment? And so it's a hard thing to address in this workshop, where we're just trying to sort of, in a way, coach you for how to succeed under the kind of the rules of the game, the way it's played today. But I think it's absolutely true that while we would all agree, I think, that our sector wants to be evidence driven and wants to be responding to the true needs in the community in the most efficient and effective way, how do we collectively find the resources to do that well, and who should be responsible for doing that, and where? It's an important question. So yeah, thanks, Sari. Yeah, there are some funders, as Rahid is mentioning, that do explicitly earmark resources for evaluation, which is great.
For sure. And I think another piece that's important is, as a sector, we should just be focusing a lot more on opportunities and funding to develop capacity for organizations to sort of collect this data on their own and do it in a sustainable way. So, it may not be carrying out like a elaborate evaluation, but the ability to construct a survey and analyze that data, the ability to run some key informant interviews. This is a capacity that, as a sector, we should be working on developing across the board. And another key point I think here is that, and at TNC, we try to do this as much as possible, is when we are working with smaller nonprofits, advocating to funders that they may not have the time and resources to meet all your reporting requirements. So to consider those circumstances and be more flexible with the reporting requirements. So it may be that instead of creating a 20-page report where they report on all these numerical indicators, it might be more suitable for them to have a more narrative-based report that shows their accomplishments and challenges, and some indicators that they are able to collect that are also meaningful to them. So trying to find a middle ground where the learning is useful for the funder as well as the nonprofit organization. I think this type of advocacy, wherever we can, we should be doing that to sort of create this understanding with funders. All right. So did we want to switch to communicating findings based on evidence, the next section, Andrew?
Sure. So, and this really relates to what we're chatting about. So I'm going to throw up a slide that I hadn't originally intended to share, but I think the whole theme of our conversation this morning is around a narrative, right? Connecting the dots between these different pieces in such a way that you build a message that is persuasive and engaging and that is your own, right? And I think that's the secret to all of this, I think. And I call this slide the pathway from evidence to stagnation. So what sometimes goes wrong is, okay, there's evidence, there's data, whatever, it might be limited, it might be not as much as we'd hoped, but there's evidence. We've got evidence from the community, from our program. What happens next? Well, I think sometimes what happens next is limited time is given over to reflection. Data points are considered in isolation. So people just kind of glom on to, our wait list was this long, or they glom on to, we had less attendance than we did last year. And sort of, they look at individual points of data in isolation, and then they don't connect them to stories, they don't connect them to context. If there's confusing messages in the data, they're sort of rationalized or ignored, or people say things like, well, we really didn't have time, or well, we'll do better next year, or well, numbers can't really tell the story of the work that we do. The work we do is, it's so special that numbers don't really capture it. Like, they do things to sort of rationalize or justify or explain confusing data. And then, not surprisingly, that data gets shelved. People say, oh, we won't tell anybody about that data because it's so confusing. Or it gets passed on to others in a confusing way without interpretation. I can't tell you how many times I've looked at a report to a funder from a nonprofit, and I read and I say, okay, this is what the activities they're doing. Okay, they say these are what their outcomes are. And then I shift to the report where they say the evidence they've gathered, and it's about something completely different, right? It's suddenly it's about another topic that isn't mentioned in the outcomes or the activities. And so that's what I mean here when I say data gets passed on without interpretation, without sort of pulling it into a story. It just goes, well, you say you wanted data, here's some data, kind of thing. And then, not surprisingly, the people who receive that, whether it's a funder or a partner or anybody else, they tend to sort of focus on the limitations of the data and start poking holes in it and start saying, but what about this? Did you think about asking that? Maybe you should have tried data collection this way. That doesn't feel good. So anxiety about evaluation grows. The level of understanding between stakeholders stagnates. So, you feel nervous about sending things to a funder next time because of what happened last time. And then, nobody wants to do evaluation next time, right? The next time you go out to gather data, people remember what happened, and people will say, oh, it's not going to capture things. It's not going to really tell our story. They're not even going to like it anyway, that kind of thing. Now, I think when it's working well, and, this requires expertise and it requires resources. I'm not suggesting it's an easy thing to do all the time. But, if evidence is collected, evidence is organized and used for critical reflection internally. Dots are connected. Lessons and mistakes are named and discussed. And honestly, in terms of limited resources, that conversation we were just having, I feel like nonprofits spend more time and energy than they should on data collection, and less time and energy than they should on this. On kind of pulling it together, critically reflecting, making sense out of it, connecting dots, trying to sort of find some way of explaining how that data helps to advance the narrative that they're sharing. So when you do that, useful insights emerge. Useful insights emerge even if they're useful insights about how much the data sucks. They're still useful insights, right? That help you to do better next time around. And people enjoy that process, right? People feel heard. People feel understood. People feel like they've had a say. And so energy and enthusiasm grows, and you're able to create strong and interesting messages for partners and funders. And that leads to, hopefully, new interest from them, new support from them, new partners emerging. And that experience leaves people feeling positive about the cycle of gathering data and learning from it, and more interested in doing it again. And so you come back around to the top of the circle, and rather than being discouraged and frustrated and sort of stalled in terms of your learning, you're confused at a higher level about more important things, because you've learned from your data, even if it's limited. And I think that doesn't require a lot of training or expertise or resources to build that kind of organizational culture, right? Where whatever the data is, we make the most of it. And I'm sure you'll agree with me, the amount of data that an organization has very little correlation to how good that organization is at learning from its data and acting on it. We all know organizations with mountains of data that don't learn anything from it.
It's not about how much you punch, it's how well you punch.
There you go. Vishist is a martial artist, so yeah.
All right. So yeah, let's talk a little bit about evidence sharing and best practices and sometimes mistakes that can be made. So let's move on to the next slide, please. Yeah, so these are some of the common mistakes made when sharing evidence with funders, and we've seen this with clients that we work with sometimes. The first one there is not linking the report to outcomes, indicators, and outputs, things that were mentioned in the evaluation plan. So sometimes clients will start talking about the unexpected outcomes and sort of focus more on that rather than tying things to the evaluation plan. And then, if there are additional things, mentioning them as an add-on. So I think that you kind of lose the thread, and the messaging is not as clear when you do that. So the first thing when you're starting to write a report is definitely you should revisit the evaluation plan, and as you're analyzing the data, whatever themes you're coming across, try to organize them under the outcomes that you had in the evaluation plan, for example, and things that you had said you would do in the evaluation plan. How did you do them, and what did you find? That should sort of be like the outline of your report. Another one is not relating the findings to themes and specific indicators that are important to the funder. So sometimes there's an overlap between what the funder wants to know and what you want to know. Well, most times there is, but sometimes there might be things that the funder wants to know that may not be that useful to you, but just keeping in mind that these are things that you need to report on and things that you should be collecting from the get-go. And I'm sure in most cases you collect that data and you have it, but sometimes we have noticed that clients will just not link that data to the funder themes. So just keeping that in mind as well. Being vague about the data, yeah. So I think just clearly mentioning who was served, how many people were served, and what impact was had, and what is the evidence. So if you're saying that this dance program helped people improve their physical health, what is the evidence for that? Is it 95% of people that filled out the survey say that they're more flexible, they're stronger? Is that the evidence? Then you should be presenting that when making that point. So just clearly tying every point to evidence. And another important point I want to highlight here is outputs and outcomes. So we talked about that in the poll earlier on, but sometimes people will confuse these two. So how many people danced as part of a creative movement program is an output. How many people found it beneficial for their physical and mental health, that is an outcome. So just making sure those things aren't confused. And there's a point to be made around socio-demographic data as well. I think it was supposed to be in this slide. So I'll cover that here. Whenever possible, collecting socio-demographic data is crucial. because it helps you tell the story about who it is that you're serving. And you can also use that to sort of tie your findings to what's being experienced in that community more broadly. So if there are certain communities or certain groups that are historically underserved or underfunded, are you making a contribution to serving them better? And if so, like, how can you demonstrate that with the numbers you're collecting in terms of demographics? And I think this one is a little tricky because not every organization or not every group that each organization serves is comfortable with answering a standardized set of demographic questions. So I think the key here is for funders and organizations to sort of work together to come up with a way of collecting socio-demographic indicators that is feasible and comfortable for the end users. Okay, so I see a question by Laurel. See what the foundation had funded before. Were they small? What is in it for the foundation or corporation? Is it in their field of interest? Yeah, that's a wonderful point. Do your homework, research the funder and what their interests are. And I think we do bring this up later in the elevator speech as well, that when you talk about your program, your idea, you also talk about how that will serve a need in the community. And then finally, you talk about a common vision or common interest that the funder has, that this is important to you as well, which is why you should be investing in our program. Okay, so you want to move on to the next slide?
Sure. A question from Heather, though, maybe is worth answering right now.
Mm-hmm.
An example of alternative ways. Yeah, go ahead.
Yeah, that's a good question. Outside of surveys. So one way some of our clients have used, and this may not lead to numerical metrics where you can say that, you know, X percentage of this community was served by our program, but some of our clients have found it useful to collect testimonials instead, where people who were uncomfortable identifying their ethnicity or other parts of their identity in surveys said, you know, like, we'd rather just talk to you about how this program has had a great impact on us and how we experience it as part of a certain group. So they collected these testimonials and they reported them to the funder. And that is a useful way of also showing that how you're serving marginalized communities that may not be a conventional way, that may not be, you know, part of surveys collecting certain numbers. So that's one alternative for organizations and communities that don't feel comfortable identifying their ethnicity or their gender and so on in surveys. Because sometimes they feel more comfortable just talking to a staff member in person or over the phone and just talking about their experience instead.
The other idea I can think of on that is just sometimes people will draw inferences from kind of proxy data in a way, like, you know, like if they can show that there's more people coming to their program from a certain building in the neighborhood that's known to have a different racial makeup than the other parts of the neighborhood, or if people can show, I've shown, you know, how did you hear about our program? And if you're seeing more people saying that, well, I heard about it from my faith community, and you have a name of that faith community, you know, you can make an inference around who's coming to the program. And I mean, it's not as credible as, you know, directly asking somebody a survey question, but I've sometimes seen people try to get a sense of who's coming and who's not coming by making inferences from related data.
Yeah, I think along the same lines, some examples that come to mind are some of the Boys and Girls Clubs of Canada that we work with. Sometimes they talk about demographics in communities where, you know, like the demographic makeup is well known, that if it's a community that's like 90% Indigenous, or it's a community that's 70% Black. So then even if they don't collect that data from each individual, they can at least talk about how they are serving a marginalized community because of where their geographical location is. So again, it's not as good as collecting that information individually from each program user, but that's an alternative as well. Okay, so yeah, we're talking about some tricky reporting situations here. Lots of organizations, like in that first row, it's about turnover. So lots of organizations end up with data gathered by someone else who has since moved on. And sometimes it's challenging to onboard the next person. It's a new coordinator or a new in-house evaluator. So I think a best practice in situations like this is to have a good evaluation plan with lots of documentation of any changes that are made to tools, to the evaluation indicators and questions and so on. So whenever you have new staff that comes on, it's easy to onboard them. They can make sense of the data, and it's not a huge challenge every time someone leaves the organization. Second row here, and I think we talk about this often in this presentation, that the point of sharing evidence is not to appear perfect. The key is that you're using evidence to continually improve, to learn and enhance the program. So showing what you have learned from the challenges or mistakes is one of the best ways to show that you are an evidence-based organization. And as it says, like identifying a plan for moving ahead. Yeah, so this last one, yeah, often I feel like grassroots organizations or smaller nonprofits, including ones that are led by BIPOC communities, they may have findings that don't fit into conventional funder formats, but I think these are still extremely important findings. This is important information that reflects the experiences of staff, of program users. So it's important to still include that in your funder report, whether it's through adding an appendix or setting up a meeting or a presentation with the funder and disseminating that information in that way. Or sometimes it might be disseminating in other ways, such as creative visuals. So I think, okay, so there are some questions in the chat, but I think
I'm kind of answering them in the chat too. I think we're okay.
Okay, good. So let's move on to the next slide then. I think we still have a little bit of time to go over it quickly. Okay, so this is an opportunity of having a discussion with you. I'm mindful of the time, so maybe we can do this for a few minutes. If you had to tweet about what you have learned through data collection for your individual programs, what would you tweet? So you can leave it in the chat or say it out loud if you wish. So the focus here is about what you found when you and your team did data collection. It's not about what you could have done better. It's not about why you found something or how you will improve in the future. If you just had to articulate what you found from data collection that you did for your program in a tweet, so keeping it very short. So what's the number of characters for a tweet, Andrew? I forget.
I think it used to be 144. It might be 288 now, but it's like a, you know, one or two sentences, let's say.
There you go. So anybody feeling brave enough to take a stab at this? Yeah, so Heather, that's a very important point, and we touched on that as well. Making sure the data collection team is on the same page and they have buy-in on how and why the data is collected. Definitely important. So maybe we'll give it 30 more seconds or so just to see if anyone is preparing their tweet and they would like to add it in the chat or say it out loud. Yeah, so these are all important points, Annie and Julia. But what we were hoping for is you giving us an example from your program about what you found. So let's say you had a program that worked on employment, and you would say that, we found that running our sessions helps people make connections or learn how to write their resume, which increases their chances of getting jobs. So just hypothetically, something along those lines.
Great example from Teresa there of, did you know that there is more than one way to graduate high school?
Yeah, that's really intriguing as well. People would want to find out more. Okay, so maybe we'll move on, and then we can monitor the chat if anyone else comes up with tweets as well. So we're wrapping things up now, and this is the last part of our elevator speech. And this elevator speech here is really about turning data into a story. And as you can see, it's summarizing the learnings from your program, from the data collection specifically, and how they're being utilized to enhance your program. And it's also doing a call to action for the funder, saying that, this is how you can support in improving this program that is serving an important community need, and finding common ground with the funder here as well, talking about a shared vision, things that are important to both your organization and the funder. Highlighting that is important in convincing the funder why they should work with you. Yeah, so some really great examples towards the end there in terms of tweets.
Do we have time just to do our elevator speech, do you think, or should we?
So we have to do the
feedback survey?
The feedback survey as well, right? Maybe we'll do it really quick.
Okay.
Yeah.
So Vishesh and I are trying to practice what we preach. So we put together an elevator speech about this workshop, and we're asking you to kind of be the funder here. So we put up this survey, and you got to tell us how our elevator speech comes across. So I'm going to start, and then Vishesh is going to follow up. So we know that pulling together evidence is one of the most challenging parts of grant writing for nonprofits, and key stakeholders, including the Ontario Nonprofit Network and Trillium Foundation and United Way, have identified this as a need too. We know there's a lot of work going on to address this issue, but we also know that a lot of the training sessions out there are dense and technical. That's why we're taking action with the Using Evidence workshop. We think this plan can make a difference because it takes those principles and applies them to a concrete task that nonprofits do all the time, which is grant writing. In particular, we expect that this program is going to make a concrete change for our participants around improving their confidence around using the evidence they already have. Let me tell you exactly what we intend to do in concrete terms. We're going to focus on an interactive workshop that has lots of practical tips and tips on how to avoid common mistakes.
As we launch this program, we have a plan in place to learn as we go. We will know we have helped GTA nonprofits, including those with limited experience, in building their skills using evidence. And we will know this because we will be gathering feedback through a short post-workshop survey. We will be keeping a close eye on a number of possible challenges, including making sure online content is engaging. We have been working to build the evaluation capacity of nonprofits for many years. With the plan proposed here, you can help us adapt this expertise into a form that is useful for grassroots organizations and inexperienced nonprofit staff, so that technical jargon about evidence is not a barrier to getting resources, because supporting the best ideas for addressing key community issues that you have is so important. Perhaps in this process, we will also learn something about how funders can make the application process more inclusive and accessible. So that was the end of our elevator speech. Let us know your thoughts in the poll.
It seems like we're doing pretty well, Vashish, but I think it's important to say that there were over 100 people on the call and there's only 80 left. And so we should be cautious about over-interpreting this data, because those folks who left may be the most busy, you know, the people most stressed about some of these issues. So we shouldn't over-interpret these data.
Exactly. And if we were writing a report, we would sort of have a note around limitations and a note of caution.
I'm going to, just because with where we're at with time, I'm going to end that poll. Thank you very much for your feedback. And I'm just going to launch the final evaluation poll, which has 4 questions in it. So I really do hope, as people have a moment or two just to quickly give us some feedback, that would be great. And while you're doing that, on behalf of Vashish and myself, I just want to say thanks so much. You were so engaged and asked so many good questions, and that made the whole discussion, I think, a lot richer and more useful, certainly more fun for us. And thanks, Suman and United Way, for hosting this and keeping us sailing along on Zoom as we were talking. We'll leave this link